So welcome everybody to the next session of the residential care stream of Health+Care conference. It's my pleasure to introduce Dr. Jeanne Katz, Senior Lecturer at the Open University. Prior to becoming a medical sociologist, Jeanne was a social worker and then completed a master's degree in sociology as applied to medicine and a PhD in sociology. She joined the Open University in 1990 as lecturer in death and dying, and she has been a senior lecturer since 2001. Her primary activities over the past 10 years have related to A, her postgraduate student role, B, her research activities, and C, her involvement in K319 as co-editor of The Reader. The title of this session is Different Needs, Different Settings, Evolving Research with Older People. Over to you.
Hello, none of you will know what 319 is. I hadn't, whoops. Is there a mic? No, just use this one. Right, okay. None of you will know what 319 is. I didn't change my web page, so apologies for that. It's rather a change from talking about buying and selling care homes to talk about care cultures in terms of dementia care and education and training. But if you flip your minds over, I will flip the slide over as well with a bit of luck. Oops. Okay. Right. What is culture in care? We know that in care homes and in other organizations where we have many older people, there can often be what might be perceived as a culture of low expectations. Any of you that have listened to Jill Manthorpe's talk a little earlier will have heard about some of the litany of difficulties that have been in the care culture in the UK over the last 30, 40 years. We've had a blame culture, we've had the Francis report, and we've had what we could possibly see as demoralizing command and control cultures. But culture should be actually positive, and we should see it as the foundation of good care. We need to develop what might be perceived as a no-blame culture, and a culture in which people feel supported and enabled to learn how to deliver good care and, in fact, to manage good care. There have been a number of reports. Many of you will be familiar with Jocelyn Cornwell's work looking at the culture of openness and a culture of team working. And there are sometimes good stories, like this one that was in the BBC News Health just over a year ago, talking about how a particular hospital had got it right. But what is culture? It's sometimes really hard to pin it down, isn't it? It's deeply ingrained and all-pervasive. It seeps into our bones. We try to mold the behavior of people around us, even though many of us come from very varied cultures ourselves, a variety of different disciplines and different nations and ethnicities. And culture can, as we know, be an obstacle to change. But if it's used wisely, it can be the foundation of excellent care. So what is it? There have been many people that have tried to define what culture is. And one very useful definition I find is culture is the way we do things here. How we do things, our routines, our rituals. How we say things. The ways that we present our stories, the way in which we provide formats, whether it is a care plan, whether it is just a chat over tea with a colleague. And our beliefs. These shape our ways of thinking, and they're shaped in turn by our own cultures, whether they're professional cultures or social cultures or individual cultures, and as well as our experience. So how would we define a caring organization? Tom Kitwood, whose work many of you will have known of, he was a very marvelous gerontologist who died some years ago. He tried to use the term and the concept of a caring organization to show how staff need to be valued themselves in order for them to be able to provide care for others. And up here we have his 8 characteristics. For those of you who can't read them, I'll run them through quickly. Staff need to be properly remunerated. They need time when they start in a new job to learn all the basic tasks of their role. And again, listening to Jill Manthorpe earlier, when you talk about carers working with people who have their own budgets, often they don't know that, and they often don't know, understand what the personalization agenda might be and trying to adapt that to their new role. Staff need regular support. They need to get proper positive feedback on the quality of their work. They need to belong to, and they need to have a feeling of belonging to a team. They need to be able to develop in their own ways. And they need to know that there are proper systems that are going to ensure that they are delivering the right kind of care and that it is in the interest of the person who's receiving it. They also need to be able to develop themselves educationally, professionally, in order to be able to be promoted and to feel that they are achieving something in their career, whether they perceive it as a career or not. We need to also think very practically about what carer intervention is, and particularly in relation to dementia care. We need to provide proper education and training, and therefore it is central to be certain to have the right environment in which training can be delivered. But we need to recognize that workers and carers have their own difficulties in being able to receive this kind of training. So they may work on social hours. Many of them will have their own personal commitments well beyond their carer role. They may live very far away from their work. They may find it is difficult for employers to release them from the work duties in order to study. They may have a very low household income. They may have very poor experiences of learning in the past and not have much confidence in being able to engage in new learning experiences. They may also feel, and again this came up, I'm sorry I keep referring to Jill Manthorpe's talk, but it was really very relevant to it. They might not be certain at all that formal training is going to help them at all. They may feel that what they need most is to have the right personality to deal with this kind of training and the right types of sympathy and empathy for the person or people that they're looking after. And we do need to recognize there are an enormous number of carers in this country who speak English as a second language. And we make assumptions that they will understand what we're saying in the same way as we think we understand what they're saying. And they also have different cultural expectations. So, what would a wish list for education and training in dementia care be? Well, it might be low cost or even free. Oopsie, I've got the wrong one up, sorry. It may be low cost or even free. It may be delivered in a way to avoid time away from the workplace. Would that be good? Should it be undertaken at times and places most convenient to the carer? It may be able to improve care quality in a very measurable way. It may be offered at different levels. And it may also be accompanied by appropriate support for those who have particular learning needs, those who don't understand English in the same way as those who've been brought up in the UK. And there are different learning models, aren't there? That could be done through one-to-one tutor support, or it could be provided by somebody with a particular interest and experience in dementia care. And it might be, and hopefully would be, grounded in real-life dementia care practice. And one of the things that we offer, which I'm getting to at the moment, is that it enables us to network or it enables carers or students to network between different locations, dissemination of good practice. So what do we offer at the Open University? And I'm going to explain on what it's based in a moment. We offer non-accredited online courses, improving dementia care, a certificate in the end-of-life care which includes dementia care and death and dying, and another 30-credit course which is the equivalent of a second-year university course, which is called dementia care. This enables students to learn in a variety of ways. But why the Open University? Why would people come to the Open University? Because our work is, this is not working very well, is underpinned by research. I, for example, have been working in the area of doing research in care homes for over 20 years. We looked at the ways in which carers worked with people who were dying and delivering palliative care or not delivering palliative care. And we developed training materials for people working in care homes, which was delivered by Macmillan Cancer Support to thousands of care homes across the UK. We looked at what carers needed, and we looked at what people who would come approaching the end of life needed, and then we devised the materials. These have fed in to these courses that you have seen prior to this. What are we doing at the moment? We've been working recently, with the universities of Warwick and Surrey, looking at outcomes for people with dementia. And this is an example of the kind of work that underpins all the kinds of courses that you would possibly be looking at for your staff. We're trying to estimate the family and societal costs of care for people with dementia identified in General Hospital. We want to know what the predictors are for people who have dementia. And we also have looked at what happens to them when they are told by hospital staff, often with very little warning, that they're not going to be able to go home, they're going to have to go into a care home. I see a few people nodding. So these are the findings. I'm just giving you this little taster of the research that we've recently completed. That more than a third of those people with dementia who referred to General Hospital psychiatric services had died by 12 months. And of those who survived, over 80% who'd been in their own home at baseline were in a care home by 6 months. Most of those died in a very, very short time. But there were health and social care costs, and they were very, very high. And those included hospital admissions and care home fees. And we noticed, by interviewing the carers, the informal carers, that family members put enormous numbers of hours into care. And for them, this had enormous personal costs. At the same time, they often didn't feel they got the right kind of support out in the community about when they noticed their relative was deteriorating, both when they were at home and in hospital. And when they were looking for care home placements, being told they had to leave, had to find somewhere for their relative with dementia within a couple of weeks, they got very little advice. So you might want to look at this Warwick website, and if anyone needs to see the PowerPoint, you can get it on the conference website. But the results of that particular study were that transition to care home were generally very emotionally stressful for carers and some people with dementia, but generally beneficial for other people. Okay, let's just go on back to people studying at the OU. And many of you will be familiar with Open University courses, and those of you who aren't, you might very well want to have a look at some of the materials that we provide. We provide supported open learning. Our students study independently whenever and wherever fits their lifestyle best. They get all the key learning materials that they require well in time before the course, some of it via the post, and most of it on the internet now. And they can get help and support and guidance pretty much 7 days a week from somebody who really knows the material and knows how to deliver this kind of teaching. And they also, through the community forums of students, they can share their views about the course materials, and they can, rather, should I call them module? We call them module materials now. Modules with other students and with their tutors at any time across the UK and often beyond. And if they need additional help, they can get it from many of our advisors, some of whom are sitting in the front row here. And we can always enable them to develop their study skills and ensure that any particular needs that they have would not prevent them from completing their studies. And actually, we can enable them to start their studies with as much student support as they require. So should you want further information, either about our research or about studying with the Open University, this is the number to contact or the URL to connect. And if anyone wants to be in touch with me, I'll be available after the session. Thank you. Okay.
Does anybody have any questions for Jeanne? Okay, thanks very much for attending this session. I know it's the last session of the day, and I'm sure people will want to leave and go around the exhibition first. So thanks very much for attending the residential care stream today. Please do, if you get a chance, fill in your feedback forms, and Jeanne is available if anyone wants to talk to her after the session. Only too happy to talk. Thanks very much for attending today.
Bye.